I wanted to talk a bit today about constipation in children. This is commonly seen in clinic, often a significant underlying diagnosis causing it, but can be an accumulation of multiple things with perhaps diet, hydration, issues around toileting that can lead to a presentation that can be very distressing for children affected by this, but can certainly be addressed with an appropriate strategy for dealing with the underlying factors contributing to this, and also potentially with the treatment that may be needed to soften the stools and get things going again. So in terms of how it presents and when to think about coming to see us about potential constipation, well, obviously frequency of stools is the commonest thing we see, going sort of every 2-3 days, hard, firm stools, often described as rabbit dropping, small, pellety amounts of stools. Sometimes even if they're really backed up in the back passage, you can get soiling of the pants. So actually an overflow of softer stool around the hard stool that's stuck in the back passage. This can then also cause pain because of the stools that are sort of backed up in the colon, intermittent or persistent abdominal pain, fear of going to the toilet, and then which then makes a recurring cycle whereby that fear or worry about the pain that might come with passing stools stops the child going from the toilet and then exacerbates and worsens the problems and get into that cycle of sort of worsening constipation. So what to do? We can discuss what's been going on, look into the symptoms, look into what the underlying contributing factors may be. Are there any other causes contributing to this? Check neurologically just to see if there's not a problem with the spine or the nerves of the lower limbs that constipation might be a part of. Again, rare but worth looking at. And if there are associated symptoms that might suggest an underlying problem like thyroid disease, celiac disease, it may be that blood tests are indicated, but these usually aren't necessary. It may be that treatment with dietary hydration measures and potentially laxatives are enough to then treat this and get on top of the situation. Hydration can be an important issue in contributing to constipation and making sure that your child's getting the right amount of fluids to help soften those stools. Diet needs to be sufficient in fibre to then again help draw water into the stools, soften the stools and enable easy passage of stools. And then psychological factors become really important. Certainly worries and stresses can contribute towards constipation, but worry specifically about going to the toilet, pain that it might cause, being able to go to the toilet during school days for school-aged children, fear of going to the toilet and what the toilets are actually like in school can be an issue as well. So there are a multitude of factors that can contribute to constipation within a child. If you are concerned and there are problems, please book in. We can look at doing the relevant examinations, look at doing any relevant tests if they're needed, but importantly, start on a plan to try and help Florence, the excellent dietitian, would be able to talk through those dietary and hydration issues in great detail. So if you've got concerns, please do book in.